The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome today for another exciting episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. I want to thank you for joining us. Each and every Friday and Saturday, we get together and we bring to you news concerning your health and also news concerning all the happenings over at the Healthcare Authority over there at the HSA. So with that being said, this time is going to be a little bit different. I have with me Miss Beverly, the forensic manager over the HSA. And what that means, if you don't know, we're going to find out because I'm intrigued by this question. Good morning, Miss Beverly. How are you?
Good morning. I'm fine. Thank you so much.
Excellent. Excellent. So let me be the first to say, what is it that you do over at forensic at the health care? Because at the HSA, because when I think forensic, I'm thinking DNA. I'm thinking TV kind of idea. It is, it's all dramatized, but you get really into the bare bone facts of healthcare and also other things. So tell me a little bit about that.
Okay. So here at the forensics department, we have 5 different sections that I manage. We have the forensic biology section, which is, in fact, yes, the DNA side of things, forensic DNA. We receive casework from the RCIPS, and we also do paternity casework as well as databasing. So there's arrestee samples that we will analyze, and we have a local Cayman database, DNA database that we have at our department. Then we also have forensic drug chemistry. So that entails when you hear of packages washing up on the seaside, on the shores, we collect that evidence. Well, the police collect the evidence and we sample it to confirm what exactly was in those packages, that green vegetable matter or that white powdery substance.
And with that being said, this sounds like a very high-tech unit, to say the least, because you deal with a lot of things that really are not the norm within, I would consider, health. But it does have a staple and a care for the welfare of these islands. Isn't that true?
That's correct. So while we aren't doing any clinical medical work, we do have patients that come in for pre-employment. So that's another section. That's the toxicology section. So they can come for urine drug screens.
Okay.
So that would be for pre-employment or clients of the drug rehabilitation center or children family services.
Right.
Some of the schools as well. We have clients as well from there. And we also have our morgue section. So any case that has surrounding suspicious activity will become a coroner's case. And so the pathologists, we have 2 local pathologists on island, and they will investigate those deaths as well as motor vehicle accidents, murders, and normal deaths from natural causes.
Okay. It sounds like a very busy department, to say the least. I mean, when you think of all the things that you just said, and that's just, I'm sure, a sample of the things that you do. You know, a lot of businesses now do a fair amount of drug screening for applicants, and also for employees. You know, they do have random drug tests and things like that. So that's a very they have in the U.S. I know they have labs dedicated just to that. So the fact that our HSA has a lab dedicated to that, I'm thoroughly impressed just by that alone. But then when you talk about the other side of it, you know, you're talking about the idea of toxicology and things of that nature. That's a very broad spectrum of services that you guys offer over there at the HSA.
Yes, it is. It is. We also do DUIs from the police service as well. So driving under the influence of alcohol. So they submit evidence, blood samples for that as well. Okay. So we do have a wide range of services that we can offer the public, the police, customs as well, because we will get samples from confiscated samples from customs, say travelers with unidentified medications.
This sounds like you guys should have a TV show or a series, because honestly, everything that we've just talked about has equivocated to some TV show or something like that. But this is real life that we're talking about. This is real jobs. These are real people doing these kinds of, wow. That I you know, my mind is just spinning when you're talking about this. It's a rarity to have meet someone who does that kind of work for a living. If you don't mind me asking, what made you decide to dive into this realm of it? Because being a manager, I'm sure you had to be there for quite some time and all that. What made you decide to go into this specific type of, I don't know if it's medicine or what made you decide to go into this realm?
So I started out being an intern at the HSA. So they have their summer internship program that they do every summer. And after I finished high school, I still didn't know what I wanted to do, to be quite honest. I was up in the air with being a doctor. So that's how I ended up looking at HSA for, you know, some experience. And I had started out first in the surgical ward as a nurse's aide, and I wasn't too keen on that aspect. As well as watching the doctors, I realized that I empathize too much with patients. I take on their pain.
You take on their pain.
So it's like I feel it. So I said, okay, I can't deal with the live people.
Okay.
And so, you know, the following summer, I, you know, saw the department. They give you a list of departments to choose from, and I saw forensics, and I thought back on a Law and Order show that I had seen, and it just mentioned forensics. This was before CSI and NCIS.
Right.
And those,
the ones
popular.
Those are the more popular, but they dabble with a little bit of what you do.
Right. So Law and Order just mentioned, the forensics has been done. And it's like, what is forensics? But it didn't really go into it. And so I said, you know what, let me try this department, because all the other ones, I was like, well, you know, I didn't really have an interest. And I thoroughly enjoyed getting up every morning to go into work. You know, it was exciting. The lab, being in the lab, I loved being in the lab, doing the chemistry, doing some DNA, you know, the small portion of DNA that existed back then.
Right.
And it was a breath of fresh air for me. I've worked in the banks before. I've, you know, worked at Kirk Freeport before as well. And, you know, so I had a little bit of experience in other areas, and I realized I'm not quite as much as a people person as I thought. So
but you are a scientific person.
Very much so. I thoroughly enjoyed being in the lab and hiding away in the lab and just, you know, in my own zone doing the work. So that's what started me off in forensics. And then I looked into what I had to study and what was being offered as courses, and I ended up at the University of Toronto.
Okay.
And I did a year there, and then I took a year off, and I transferred to London, UK, and finished my degree over there. So I did my bachelor's and my master's. And then I came back home, and I was actually the first female qualified forensic scientist for the Cayman Islands. Forensic analyst, scientist, and now manager for the Cayman Islands.
Awesome. What a great story. And for all the young ladies out there, and this is what I love, empowerment.
Yes.
And a lot of times I'll ask stories like this kind of impromptu because I want the honest approach. And thank you so much for giving me that.
Yes.
My name is Chuck Taylor, and I'm here with Miss Beverly from the Forensic Department over at the HSA. We're going to take a quick break and be right back. This is Healthcare Today with the HSA, right here on Bobo 89.1 FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
And we're back, folks. Once again, thank you so much for tuning in to Healthcare Today with the HSA. I'm your host, Chuck Taylor. And today I'm talking with Forensic Manager over at the HSA, Miss Beverly. Thank you so much for talking with us today. Where are you guys located in the HSA? If, I know you do you do walk-ins? If I have like a paternity that I wanted to find out about, are we able to do that with you guys, or do we need to make a special appointment? Tell me a little bit about the process that we would need to go through. If I was looking for your services as a potential client, how could I do that?
So we are located at the main campus for HSA, and we're at the very back of the hospital. So if you come to the front of the hospital, there's an information desk, and they can always call down and alert us that you're looking for us, and we can keep an eye out. And they'll also point you in the direction of where to go. As for our services, we have walk-ins for the drug screening, urine drug screening. So once you've been referred to us by a physician or an agency, such as for pre-employment, for a government medical or any organization, if they request of you to do a drug screen, you register first at the very front of the hospital by the phlebotomy, where you have your blood done, and then they will send you down our way, and we'll do the collection. It takes no more than 5 to 10 minutes for the urine drug screening to provide us a sample, as long as you are ready to go.
Of course.
And then for paternity, we do request that appointments are made. So you can give us a call on 244-2855. That's our office extension. And we will take your appointment. And we usually have those appointments scheduled between 12:30 to about 4 o'clock. Okay. And those don't take long either. So it'd be a maximum of half an hour, or minimum, of half an hour to do a paternity test. And for walk-ins, I should have mentioned that For the urine drug screens, we're open from 8:30 to 12 o'clock for the moment.
Okay.
So then we schedule our paternities after the walk-in window has closed, so that the families can have a bit of privacy.
Right. Of course. Understandable. With that being said, how has forensic changed? Because one of the things and I always laugh. I said a lot of what we see on TV kind of mimics the reality of certain businesses and services and things of that nature. Everybody has been watching for years, Doctors Hospital, different shows, and they always, show the lab, and, I'm sure that there's some dramatic element to it. Of course. But with that being said, how has technology changed over the times that you started, or even today? How different is it? Tell me a little bit about that.
So my specialty is toxicology. So we still use the same instrument, which is the GCMS, gas chromatography mass spectrometer. And that's been the gold standard for decades now. The only change is just having a newer model, basically.
Okay.
And, the processes, pretty much are still the same. We have the capability to test for poisons, for, we can quantify the amount of illegal substances in someone's samples, such as cannabis or cocaine. It's just for us to, as long as we have the standards that we, have to compare what we are finding, unknown to a known.
Okay.
Right? And so, and there's a lot of instrumentation out there. Of course, they're quite costly. So we...
I'm coughing, but I was going to come to that after you finish. Let's talk reality costs for this a little bit.
Yeah. So as for DNA, there's a lot of testing methods out there. There's touch DNA, and it just depends on the amount of sample that is available for them to test for DNA, and in caseworks for that is submitted to us from like the burglaries or sexual assaults and so on. And each sample, depending on what it is, can require different tests. And there's kits that we purchase. So like there's YSTRs, that's for the Y chromosome, so that's more for male, testing of the male DNA. Then there's then there's the regular DNA testing, STRs that we test for, so that would be for the forensic DNA casework. And there's different kits, there's different instruments, and again, quite costly depending on which one we're able to purchase here in the Cayman Islands. And we also have to look at the demand for it, because we are a small establishment, we are a small island.
Right.
When we grow a little bit more and we're able to, say, branch out and offer to other jurisdictions, other countries, neighboring countries.
Wow, okay.
That's something I plan to look into and continue, because we have had a couple countries ask us to do some casework for them. It's not a lot, but we've had it previously before.
Do you think that is a viable interest within the region? To look outside, because I always go, we live here in Cayman, and we're quite lucky to have so much information at our disposal.
Yeah.
And when I say information, a lot of places, you think, oh, they have internet, they have these machines, but $100,000 machine is their whole department budget.
Right. Exactly.
You see, so when you think of things in that capacity, and we have the luck and the ability to be on the forefront of the cutting of this information, do you think that's something that we would be able to viably offer to the region?
Yeah, I believe it is, because not every country has a functioning DNA lab or toxicology lab. They may have one aspect of forensics, or they may have their sample size is more than they can possibly manage at the moment.
Okay.
So we've had where, for instance, Belize, for example, has sent us casework before, and it was I think it was like a trial run to see how would it work out with sending us the samples, how will they hold up in transit. All those logistics do play a part into it as well.
Right.
So, but it is a possibility, because, for example, I also manage the molecular biology section, and they were primarily doing the PCR COVID testing for the Cayman Islands, and so they are also branching out. So they're doing breast cancer genome sequencing, and there's influenza genome sequencing, and a lot of other services that the microbiology section is offering, and they are able to accept samples from overseas. There's CARFA that you can send. We were sending to, and when we started to offer in-house, we didn't have to send to CARFA anymore.
Right.
But we're on a level where we can accept certain samples for testing from other regions for microbiology, not just in the Cayman Islands, and that's something that's definitely being explored in for that section as well.
And I think that's a kudos to our team here. I don't want to say intelligence, but the dedication that you and your team have to being the best, because when people start looking and wanting your services, that goes without saying that the volume that you do is understandably good and on a par that gets noticed regionally and internationally.
Yeah, because we've also just last week actually, we went through our reassessment for accreditation, and that's another check mark for a lab that once you finally have accreditation, we've been accredited, and every year we have to go through the process. We had our assessors come down last week. They spent 3 days. It was 6 assessors, and they went through all of our documentation, all of our standard operating procedures, our manuals, and our quality management system. And they check and go through it with a fine-tooth comb to ensure that we are adhering to and conforming to international standards. So once we get, we have, if there are non-conformances, they give you time to correct them. But we were very successful with our reaccreditation, and early next year we will continue. Well, it's ongoing. The process is ongoing for accreditation, but that is just an extra additional bonus for our lab to offer and to highlight when agencies and clients look to us to use our services, because they know that we have accreditation and we are conforming to the international standards that all forensics labs have to conform to when they're accredited.
And with that being said, you kind of alluded to my next question. What are some of the various community entities that you do? We know some of the work that you do, but tell me some of the community entities that look to you for services.
So one of our primary clients is the RCIPS with their casework they send over for DNA. And we also do work with the CBC, Custom Border Control, as well as we have clients from public transport units. So the taxi drivers that require, licensing, they have to get their drug screens done through us.
I did not know that.
Yes, they have to. Yeah.
Okay.
So they're a large group of our toxicology section. We also do students who are applying for, say, government scholarship. We do Cadet Corps when you're applying to join the Cadet Corps. We also have clients from the Drug Rehabilitation Center, Children and Family Services. There are some of the schools as well that, send their students to us as well. And regular parents, if they wish to randomly test their children or their child.
There may be a need for that.
Right. So they go through a doctor. So they can go through a private doctor or a doctor at the HSA who will refer them to us, and we can do their collection.
Okay.
So we have a wide array of
it
clients.
seems like a wide, and seeing that we are, and I say we as the HSA, such a great, I'm sure the judicial system for various entities, legal, family services, and things like that, they use you also.
Yes. So yes, the courts can send, they can request paternity tests to be done as well of clients that are in court. We also, for like, say, our drug drug chemistry section. We produce certificates for when we're confirming that, yes, that vegetable matter is, ganja, cannabis, or whatever. And that is what gets sent over to court through the RCIPS. Okay. So they'll collect reports from us for DUIs when we get samples from the RCIPS for DUIs, as well as they send urine samples too for drug screening for suspected drug use.
Okay. And I want to just toss out there, folks, what we're talking about here is a world-class facility, but by no stretch and means, we are fully blessed to have this operational within our home and within the region, because from some of the things I've heard you talk about, this could be on par with any U.S. or European, UK. We could be dropped in there and managed quite well against all of the things that they do and what we bring to the forefront. And I think in a lot of cases, you probably do more than most of their average, because a lot of them only do one specific thing in their labs. Either they do blood work or they do DNA, but we have a wide assortment of range within the HSA, and kudos to that. So if let's just say I'm listening to the program, right? You know what? We're gonna take a pause. You tuned into the HSA. You tuned into Healthcare Today with the HSA. My name is Chuck Taylor, talking with Miss Beverly, the Forensic Manager. We're going to take a break and come right back, and I'm going to ask her one of the hardest questions I've asked anybody. I promise you that. Keep it right here. This is Bobo 89.1 FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome to Healthcare Today with the HSA. I'm your host, Chuck Taylor, talking with Miss Beverly, the Forensic Manager over at the HSA. And I promise you, I'm going to ask her the hardest question I've ever asked anyone, because this is so important for me and for the young people right here in the Cayman Islands. How can I get into this exciting field that we call forensic scientists? If I'm listening out there and I'm intrigued by what you're saying, and I'm thinking, you know what? I don't want to work in bank. I don't want to work in tourism. Those are all great ideas, but here's something that intrigues me. I've watched it on TV. I've watched it in movies. This is like a dream. I want to wake up and be excited like how Miss Beverly is about working. What path would I have to do to get into a forensic lab?
So you just need a bachelor's degree. Most people go and do their masters because it's a competitive. The world is competitive at the moment. But a bachelor's degree. So, for example, you can get it in chemistry, biochemistry, any of the chemistry type subjects, for toxicology and drug chemistry. For biology, forensic DNA, because we follow the FBI standards, you have to ensure that spread through either your bachelor's and master's, you have 4 core subjects, which are biochemistry, molecular biology, statistics, population genetics. There's 4 certain subjects that have to be, have to be done for forensic DNA just to get your foot into the door. There's a lot of people that went before the standard came into effect. A lot of, the older scientists have to actually go back and do a course just to meet the requirements.
Okay.
So for it's quite strict when it comes to forensic DNA, but for the other disciplines in forensics, a bachelor's in a relevant subject field is what's required. And forensics can be, you can literally put forensics in front of any job title and it's a legit job. So you have forensic accounting, you have forensic pathology, which is, being a pathologist, but you've specialized and got training in forensics. So you could be in Cayman Islands Fire Department and you can specialize and become a forensics fire investigator, so that there's a lot of is very broad when it comes to being in forensics. There's a lot of disciplines you can go into, and it doesn't have to just be lab work.
Okay. And see, and that probably will entice a lot more young listeners. And sometimes I want to say, I want to shout out to them, part of the reason we do these types of programs, or I like to do these, is so that people can hear other walks within the community. It doesn't have to all be one thing here, because, honestly, you're in the lab. I would never have the opportunity to have this interview with you or even talk to you about what you do, because it is so specialized, except the certain, people that come to you for services, then they know who you are.
Exactly.
But you literally can, and I'm not saying that you're moving, you can literally drop Miss Beverly in any department in the world, and she would function as she does now, because this is the core of her industry. And kudos to you and the team over there. And for anybody listening who, wants to take that path, she started off as an intern on the HSA, as she said earlier.
Yes, I did.
And that path still exists today. Am I correct?
That is correct. Every summer they have their summer internship program, and it opens, I would like to say April, where you can apply. So in time for the summer. But you can always keep your eye out on the hsa.ky website. And they always advertise it as much as possible, and I believe in the newspaper and on the radios. So they advertise when the program is open for applicants to apply. And we try to, within my department, I try to accommodate as many students as possible, because I'm an advocate for sharing the knowledge and encouraging young students to pursue this career path. It is different from banking and tourism and being a lawyer and a doctor. So there are other options on the island, which when I was growing up, those were the 4 core, jobs that were highlighted. And for me, none of those interested me. So I was more than happy when I realized there are alternatives.
And that's one of the things I think we live in a society where options are kind of the normal. Growing up is just a few years ago, because we're all young people.
Of course.
Of course. And the idea of working in a lab was not a thought. It was I wouldn't even say a notion. It was only if you got to university and then you're like, oh, what is this? We have to take a biology. Okay, I'll take molecular, whatever. And you're like, wow, this is really a thing. And so I think a lot of times the generations that are coming out now have that advantage. And with saying that, I'll just toss this in and then we can discuss it a little more. Is it anything like TV? We always see which city in America doesn't have a CSI TV show.
Right.
CSI Miami, CSI Baton Rouge, LA, New York, so there's a department in every one of these cities, mind you.
Right, that's true.
But is it anything like that?
Well, the big difference is the turnaround time. It's not you put something in the instrument and 2 seconds later it comes out.
so literally like, oh, we have the cure. We have this. It's a little bit labor intensive.
Yes. So, depending on the analytical method that we're doing at the moment, it can range from half an hour to 2, 3, 4 hours to a day of work, and the instrument itself can take anywhere from 5 minutes to analyze a sample to an hour or more. But then when you're combining a batch of samples, then that whole run, we could leave the instrument overnight running, so it's not as, clean cut as the TV shows make it out to be. Yes, we do have the nice white lab coats, but time wise, it just, for the viewing pleasure, they make it very quick.
Right. It's a little bit more intensive than what they portray it time wise.
Yes, exactly.
Because and I think the idea of learning and seeing things in motion, I think that's kind of the draw to some people in your industry. Like they want to figure out what it is that happened. They're trying to find the end of the story.
Right.
And I think that is one of the things that draws people into a specific industry is they want to learn, they want to be a part of that change, that movement to make it happen. And you were telling us a little bit about your story earlier. And folks, if you're just tuning in, I'm talking to Miss Beverly, Forensic Manager over at the HSA. And we're basically having a conversation about all things that her team does over there. And she told me a little bit earlier about how she got into it. What's the drive that keeps people in your industry?
My colleague that was with me previously on the other talk shows, one of her drive, and it can be said for all of us, is that being able to help solve a case, us being able to analyze evidence and give for instance, our CIPS a name to go with that sample they brought in. We can, depending on the evidence submitted, we can analyze it and we can get a possible hit from our local DNA database. And if this person is a repeat offender and, we've gotten samples from them, from, for example, a burglary scene where they left behind their DNA, being able to solve that and say, here is a name to go with this perpetrator, and you could take that across the board. Also, for example, in an autopsy, giving families closure. How did my loved one die? Right. Even though it was a car crash, like there's people who get in car crashes but survive. What happened specifically that caused my loved one to pass away in this car crash?
Being able to give a full picture of the scenario. And one of the things, and someone had sent me a message, said, the forensic team helped solve a murder, helped solve a situation that vindicated me. And I, although, I was placed there, it wasn't me.
That is also true. Yes, you can use, DNA and our analytical methods to help exonerate someone, to
eliminate situations.
Exactly. So, right, as you gave your example, I was there, but it was not me. Right. And then, whatever else evidence was submitted pointed in the right direction. We of course have to remain unbiased, and we don't put our feelings into it. We just have to analyze what's given to us.
The data that's there.
Exactly.
Do you find that puts you at a level playing field when it comes to looking at information? That you have the ability to be analytical? Because a lot of times, and I'm just throwing a scenario out there, mind you, folks, that we're talking. People tend to put their personal thoughts into a situation.
Mm-hmm.
Sometimes it may be biased one way or biased another way,
Mm-hmm.
and the data that you find doesn't fit what is being said.
Mm-hmm. The key point there is that we have our reports that are structured a certain way, our methods are structured a certain way, so that as much as possible, bias is eliminated, right? We don't get all the full details from the police about what happened in a case. They submit their evidence to us.
Okay.
And, there will be a summary, right? But we don't go to the scene and collect the evidence. The police, the scenes of crime officers do that. So we don't have that, oh my gosh, this was a horrendous scene to look at and have that stuck in our minds.
Right.
In the lab, we may just get a couple swabs, or we may get an actual, for example, a shoe with some blood on it, and we just swab the shoe.
Right.
So that helps also to, eliminate as much bias as possible. And, and to make sure, like, when we're analyzing, we're looking at the data, and the data can only say it can only say what the data says.
Right.
Right. And we can only say, this is what the data shows. Like, for example, in toxicology, you're either positive for a drug or you're negative.
Right. There's no gray area.
Exactly.
It's not. It's not they looked like they used it, or they walked in, either they were positive or they were
negative.
not.
Exactly. And there's the instance where they can disclose the medication they're on, and if they're on cannabis oil, then they disclose that, and it's there. As they were prescribed medically this drug, and they're using it. They've disclosed it on their paperwork. We found it in there. We can't determine the difference between. There's no difference between the cannabis oil and actual smoking a joint. The chemical that's in the body is still the same.
But there is a difference between between cannabis and cocaine. So
exactly. I do cannabis oil, but there's something else in yours. And we leave that to the agency to discuss.
Right, exactly, right. But that's what I'm saying. At the end of the day, the data can only say what the data says.
Mm-hmm.
It's not that you're adding anything into it.
Exactly.
And one of the things I always go back to, there was a very my memory may be a little bit off, but there was has been in the past cases of DNA coming to light, 20, 30 years later, and people were found either guilty or not guilty about it because the data can only say what it says.
Yes. So I would say that's, that can be attributed to new methods, new and improved methods coming out all the time. The older methods may have needed maybe 5 milliliters of sample versus right now we can do touch where it's like a skin cell and you can, maybe a bit of an exaggeration, but just to put it in perspective, you can literally just touch the countertop and we can swab that and get DNA off of that.
Okay.
Versus having to have you scrape your whole skin, or an actual large sum of blood to test.
Right.
So as methods develop and instrumentation is developed and improved upon, so is the data. And then, if it's retested or, maybe they go back to a cold case and they're like, back then we couldn't get something with this method, but we're trying with a new method, and you may be surprised that they get, results.
Understandable. We're going to take a quick break, but I'm going to ask you a question and then we're going to come back. And it's a TV related question. So we'll give her time to think about this. Have you watched any of these shows? Are any of them your favorite? Or have you ever really called, nah, that's not really it? They've made some embellishment on a scenario, We're gonna ask Miss Beverly that when we come back. You tune in to Healthcare Today with the HSA. I'm your host, Chuck Taylor. We'll be right back after this break.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor, talking with Miss Beverly. She is the forensic manager over at the HSA. And just before we left, I asked her the ultimate question, which was kind of a two-parter question. TV show-wise, forensic TV has been a big thing from CSI to a whole bunch and range of them. Is there any that she liked? That was the first one. And the second one was, has she watched something and was like, I'm just going to call blank blank on that. That's not realistic. Because remember, she's in the know in the department. So, Ms. Beverly, I'm going to leave the floor for you to answer these two prying questions into your TV life and into your world as a forensic manager.
Well, when I was away at school studying is when CSI Las Vegas first came out, and I initially wasn't interested in it until my roommate started watching it, and I sat down and I was watching with them. And when I would go to class, the professors would all say, okay, forget everything you see on CSI. They are just outrageously outlandish. Nothing goes this way. And so they do get some of the instruments correct, It's just the main thing for me is the turnaround time where they're like, I'll have something for you in 5 minutes or it'll be ready in half hour. And it's like, no, you haven't even done the analytical steps yet. And you're talking about, I'll have something for you in half an hour. So it's more of the just being able to say there's a lot of steps involved before you get your result. And but I did quite enjoy watching CSI. I did watch NCIS as well. And Law and Order. They started getting a little bit more into the forensics, the evidence collection, and so on. So those are just to name a couple off the top of my head at the moment. Those are the ones I used to watch, and I used to watch them with my mom. So yeah,
a little bit of touch here and there. With that being said, you brought up the instrumentation. How expensive? And I'm not saying drop all of your budget numbers or anything like that, because I do know it's probably extensive. In terms of equipment, what's considered kind of the gold standard money-wise for equipment and things like that in a viable lab? Well,
I mean, you have the option of getting brand new, or you have, where we've had refurbished models, because to get a brand new spanking machine, that could be upwards of 100, 200,000 or more,
Really?
It can be, yeah.
Okay.
And then it doesn't stop there. It's not just the instrument. You need the reagents to go with it, the chemicals that you need to use, and the kits to prepare the samples and so on, and those are costly as well. So, and then every year we have to have preventative maintenance done, and because we're an island, we have to fly in technicians and engineers because they're specialized equipment. So it's not just the instrument, one payment for the instrument and you're done. There's
continuous.
Exactly. The cost continues every year because we need to make sure we have enough reagents and chemicals and supplies, even down to the materials such as test tubes to work with and stuff. So, and also, like I said, the engineers coming down once a year. And because we have different types of instruments, it's not just one engineer for every instrument. We have an engineer that comes for the drug chemistry and toxicology instruments. We have an engineer that comes down for the forensic DNA instruments. And we have an engineer that comes down for the various instruments in molecular biology.
Wow.
Right. So it may seem like, it's not a very expensive ordeal to have a forensics lab.
Realistically, when you say, I get this machine to do this test is going to be $50. just tossing out there.
Yeah.
The kit may be $30. And then you have all of these incidentals that you really can't put into the cost, but it's there no matter what to run the lab.
Yes. We do try to not break everybody's bank with the cost. I mean, for example, we just upgraded our drug screening instrument, and instead of offering, being able to test for just 8 drugs, we can test for up to 20 now.
Okay.
So that will cause me now to have to look into the price of the test that we'll be charging. That's something I'll have to look into. But for the moment, we're just charging one set fee for it instead of, because we used to offer different, not packages, but different panels. So we could test for 2 drugs, we could test for 4, we can test for 3, we can test for 8. Now with our new system, we just test for all 20. So now
it no matter if it's there or not, you still test for it because it might be there.
Right. So I mean, it's not whether it's there or not. It's depending on our client. So if the client or the agency was like, we only need cocaine and THC tested for in the person's sample, it's like, well, yes, what you may only need, but with our new system, we test for all 20. What we can do is change our, edit our report. So like if you're really not concerned about tramadol or an over-the-counter medication that's on the panel that we can test for, we've tested for it, but we can edit our report to say, just to highlight the drugs that the agency is interested in.
Okay. And I think that the reality is that you should test for all of them because you just don't know.
Yes, exactly. That was something, and I do want to have, meetings with our clients, especially like the drug rehabilitation center, just to highlight that these are the drugs, these are what these drugs are, because it's not just cocaine and cannabis and ecstasy and amphetamines, and we also test for over-the-counter drugs, like, and then there's opioids, opiates.
Yeah.
And
I think that's kind of the changing times. Because I being a parent, and you talk to your kids, I was like, so what do you know about inhalants? And she's like, oh, I know about inhalants. What do you know? I said, I know nothing. And she's like, okay, come, let me sit down. Let me talk to you. Well, this is what they, and I'm like, okay, wow.
Right. Our children are teaching us.
Yeah. Our kids know, we have to be understandable of the amount of information that's out there.
Exactly.
And a lot of times having a conversation about drugs at a kitchen table was unheard of.
Yeah, it's true.
I
never had that conversation at all.
What? Oh, they're smoking marijuana. Okay, but now it's a medical situation. So the times have changes in certain aspects, but then we as business and understanding and parents and adults, we need to understand what's going on in our community also.
That's
and
true.
I think the fact that you over at the HSA test for all 20 is a great idea.
Yes.
Now, mind you, as you said, you may not need to know all of it, but at least you do, because maybe it will show up red one day, be like, okay, so there's no cannabis, but now there's inhalants, there's opioids, because they're two different things, but they still impair your judgment. They still are considered drugs.
Exactly. And, it's up to the physician or the requesting agency to take a look at that report and make their decisions based on the report. We just do the work and we submit our reports to if it's a private doctor or the doctor at the HSA, when they're coming in for pre-employment, when they look at the results, they will then have the opportunity to delve more into what shows up on the report, because they have access to information we don't have access to. We don't have access to patient records.
Right.
So we just say, yes, we saw X in their sample. And then the doctor can then go in and say, well, they can check their medications, their medication history. And then they're like, that's fine.
You have no background knowledge of what you're looking at. You're just looking at this right now.
Exactly. Yeah. So that's one thing. We don't do anything. We don't make any clinical decisions or medical decisions. We do not have access to patient records and their files. We just test their samples, or we get evidence from the RCIPS and CBC, and we analyze and submit our reports. That's
understandable.
All.
Well, as we get set to wrap up, Miss Beverly, is there anything you want to say in closing before we get out of here?
I'm just grateful for the opportunity and that forensics is being highlighted. We've always been in the shadows and, at the very back of the hospital. So it's good to be able to talk about my profession. I'm extremely proud of the work that we are doing. I've been at the forensics lab from 2010 since I came back from school, and it's been a whirlwind to be, a roller coaster. And I'm excited for this new chapter in my life since, now being appointed the forensics manager, and I look forward to expanding the lab and looking at more ways to give back to our community.
Excellent. And if anyone's out there listening and they want to be part of your exciting profession, how can they reach out to you or reach out to the HSA for the internship or things like that? Or maybe they're away at school listening and they want to get into it. How can they reach out to you?
They can always, give me a call. The lab's extension is 244-2855. And they can always check the HSA website, hsa.ky. There is an actual volunteer program that they do, so that you can check the employment vacancy section of the HSA website. And then, like I said earlier, there's the internship program, which I believe opens in April for applications, but you can definitely just keep your eye out on the HSA website. Awesome. And all that information is there.
Perfect. Thank you so much, Miss Beverly, for stopping by here today.
Thank you for having me.
Thank you for listening in. That wraps up another exciting episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. Look forward to seeing you. Have a great Christmas, a great season, and a wonderful new year when it comes. Keep it right here. This is Bobo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.